Hello, Professor Young and Perspective on Wellness class. My name is Jessica Taylor, and I'm going to be talking today to you about autism spectrum disorder. Some of you may be familiar with the movie Rain Man, or it formerly known as Asperger's disease. That autism spectrum disorder was recently put together a combination of different disorders that are now together known as autism spectrum disorder. It's autistic disorder, Asperger's disorder, childhood disintegrative disorder, Rett's disorder, and pervasive developmental disorder. And what that is, it's a developmental disorder that is based on a spectrum, which means no two patients are the same, no two patients have exactly the same symptoms or suffer the exact same challenges. They may be called high functioning or lower functioning based on what type of challenges they face. The CDC keeps reports of children diagnosed with autism spectrum disorder. Back in 2004, every 1 in 125 children was diagnosed. As of today, that number has gone up to 1 in every 68 children. Boys are more susceptible to autism. 1 in every 42 boys, according to the CDC, is diagnosed with autism, and 1 in every 189 girls is diagnosed with autism. Diagnosis usually occurs around ages 2 to 3, but signs may show earlier during their baby years, and parents may notice that babies are not reaching their milestones. What that means is certain social skills and language skills where babies will not develop on time. People who suffer from autism spectrum disorder have a hard time with verbal communication and speech skills. Their speech skills may be slurred. They may not necessarily process how to express their emotions. Oftentimes you'll see children having meltdowns because they cannot communicate to other people what they're thinking in their head. And the CDC estimates that about 1 in every 3 people diagnosed with autism disorder remain nonverbal throughout their lifetime. Children with autism disorder also may suffer from motor skills, meaning their muscles and their bones may not develop correctly. They may have trouble doing simple tasks as far as holding a pen and correctly writing and drawing their own names. And children with autism also are susceptible to many other types of medical issues. They often have GI disorders. They may suffer from seizures. Many times they have trouble eating certain things because the textures overstimulate their senses. They have sleep disturbances. Many children with autism suffer from ADHD, anxiety, OCD, and may also have certain phobias. Some of the signs of autism are intense interests in random things. A child might narrow in on one specific thing and not really be alert to anything around themselves. They may avoid eye contact or lack eye contact. That's a huge sign, especially during their early years when your babies are not being alert to you or responsive to your voice or your call. And children with ASD lack understanding for feelings of themselves or other people. They also might repeat certain phrases even if they don't necessarily want to communicate anything to you. And they also do quirky things like line up all their toys in a straight line for no apparent reason. They may also get upset very easily as far as having their schedules changed, may overstimulate them and cause them to have breakdowns. And they may have repetitive behaviors like flapping their arms or continuously moving in circles. And they also have intense senses, which means they're very, very sensitive to light or tastes or smells or certain textures of their foods or feeling, similar to the scratching on a chalkboard. Children with ASD are very sensitive to different types of textures, hearing different things that we might not necessarily hear, such as being in a grocery store and they might hear the light that small little buzzing that comes off of a certain light that we may not think about, but it'll be intense for children with autism. The causes of autism are not known. Researchers have found certain things that may increase the likelihood, but even researchers say that just because a child has an increased likelihood, or they check the boxes for things that might increase their likelihood, doesn't mean that they will necessarily have autism. In fact, they say that most people, even if they are exposed to the increased likelihood, genetic or environmental factors, they most likely will not end up with autism. But they have found that autism is prominent in families, meaning a parent has a specific gene, or somewhere through the embryo stage, the child develops the gene and will end up with autism. It's also much more common in babies of older parents, whether it be the mother or the father, giving birth at an older age. And common pregnancy complications can also increase the likelihood of autism, such as having a low birth weight, being premature, and multiple pregnancies less than 1 year apart can also increase the likelihood of a child developing autism or being born with autism. Contrary to what many people seem to believe, vaccines are absolutely not a factor in autism. Researchers find that autism may affect the early brain development instead of the child necessarily being born with autism. Something may not develop properly. It may affect the way certain nerve cells communicate with brain cells, or just with it throughout the body in general. And treatment for autism is very specific to the child. Whatever the child may need, as far as speech therapy, language therapy, they may need counseling as far as getting in line with their feelings and trying to socialize with other people and understanding exactly what that means. They might also seek occupational therapy for their motor skills. Children with autism tend to seem very clumsy because they're not really aware of their own body presence. So they may walk into a wall, walk into other people, and not really understand what that means. So autism is not very well known right now, but researchers have been advertising for autism, and it's becoming more and more well known. There's more and more resources every day for children with autism, as far as Children Speak or Autism Speaks, and autism.org is the best way to get information about autism. Any parent that feels that their child might have any signs or symptoms of autism, even if it's early on, should talk to their doctor about screening for autism and getting help as early as possible. The best way to improve an autistic child's quality of life is to intervene as soon as possible and get them treatment early in life rather than later. And that is all. If you have any other questions, then you can go to autismspeaks.org. That has been my presentation. Thank you very much.